and you're one of the front desk receptionists. I was coming out of my hour-long cleaning appointment. I'm sorry, I was coming out of my hour-long appointment that didn't wind up being a cleaning when it was supposed to. Okay. And I just gotten bad news. It's going to be hell. It's going to be thousands of dollars. And none of it is good. It's not good to get a root canal. But the alternative is having your tooth pulled and an implant and going without a tooth for a year. And Joe went through that a few years ago. And it's hell. And yeah, insurance. I can't afford that kind of shit. But you can't just pull a tooth either. You pull a tooth, your mouth shifts. You can't just pull a tooth. It'll change, it's just hell. I'd gone through all of that. I had tried to contain my composure because I was so pissed when the hygienist kept smiling, but we're not going to be, I want to be able to do a good job. We don't have enough time. We're not going to be able to do your cleaning. And I'm thinking, I feared that this would happen, but even Joe was like, oh no, they allow for that. They're going to have to do the x-rays and you're a new patient and paperwork. And no, they didn't allow for any extra time. And then I have to get snapped at. Snapped at. I didn't do something that I didn't, that I didn't have to be doing for the past hour. Okay? I am livid. And then they wound up having a cancellation, and I was hanging out there for hours anyway. Joe wasn't going to be able to pick me up till after work. I happened to still be out there, hadn't left yet. And I was going to I was out there calling immediately the place that they recommended to go for a consult about this. And then I was going to make a dental appointment for a cleaning for after that. Then we could fit you in. We just had a last minute cancellation. Like, yeah, whatever. Do it, whatever, And then I'm dealing with the same woman who's so nice, but doesn't stop talking, doesn't shut up, not for one split second, asks me questions as her new patient, and she's getting that I can't answer, and because I have the things in my mouth, and then I have to take time to answer it. And my old one that I saw for years and years and years is consistently, because when I do something like this, I consider it even like hair, whatever, it's going to be a long-term relationship. Okay, maybe it's not protocol these days, but it is at my old dentist, because I just saw him 4 months ago, but this woman didn't floss my teeth after cleaning, didn't take my blood pressure, and didn't test for, for throat cancer, whatever. Not a big deal. The flossing thing, I mean, unless they change or they don't have that protocol these days, I don't know. But I'm used to that being done. And I'm also used to there being a little bit of pain and you scraping. You can use the electric thing, that's fine. But my old one would use the electric thing and still, the electric thing can miss stuff. She would still examine and do some scraping and there'd be a little bit of pain. Little bit of pain if my gums are bad enough that you think I need a 4-month follow-up like before. But I guess they don't make those spit sinks anymore. So I wasn't able to spit and see if there was any blood. I asked her how were my teeth. Oh, they weren't bad. I'm thinking, well, you're telling me to continue with the 4-month follow-ups. The last time, I had a little bit of pain. You tell me my gums aren't good. There are 5s with the measurements, and yet I felt no pain at all. And I don't think she did a real thorough, deep thing or whatever. Okay. Not what I'm used to, and I'm used to it as a general cleaning. But I don't know anything about her. She could be just fresh out of dental school. I do know that she talks about everything constantly and doesn't shut up for 1 second. And I don't like that, but, you know. And even though they didn't do my cleaning first time around, which was just 2 hours prior, they did the measurements, but they didn't bother to look at my record, so I don't know if my gums got worse from the last time. I don't even know why I killed myself to get the records that you don't give a fuck about anyway. Oh, we got an email, but it looks suspicious, so we didn't open it. Meanwhile, you know my dentist was sending you the records. I mean, like, it looks suspicious, but we didn't open it. Because it was protected. Yeah, like Joe said, duh, it was protected because of HIPAA. It was protected because it's her personal info. And the fact that you didn't recognize that, does that mean when you send out records, you don't send them protected? Which goes full circle. Why should I want to fill out the paperwork online and put my social and all of that, you know? I've been to places where you had to fill out paperwork and they have you come, they allow for that time. But I was there early enough, you should have given me my fucking paperwork. Unlike me, you knew that you're only allowing the same fucking time for everything to be done. Me, a new patient, bite wings, panoramic, and regardless of whether they only take a few minutes to do x-rays or whatever, is not the point. I'm a new patient. You're going to have questions for me. I'm going to have questions for you. You're going to ask me questions. And the exam, and I'm having mouth problems and the whole cleaning on top of it. And I wasn't given any forewarning that we might not have time to do your cleaning. You might have to come back for that. And someone with a car could just hop in the car, no big deal coming back. Someone like me who would have had to go 2.5 hours total public transportation and walking and not knowing where I'm going and this, that, or whatever, you know, that's a big fucking deal. To not even be warned. Instead it was, don't worry if you can't get to doing the paperwork. We can just print it out for you. And then they were having trouble printing out the top page. Call me right on the dot. So the time we got situated, i.e. she had to bring me out the paperwork. We had to go get me situated out there where, since you weren't on lunch because I called you at 12, you could have given me the paperwork ahead of time but didn't bother. No big deal. Rush. Brand new patient. I won't be going back. I don't know. I'm tempted to go somewhere else, like even before 4 months, and see and say what my experience was. Like, I'd be tempted to go now, like next week, and not say I just went somewhere else, and see if they have to do scraping and stuff, which would prove that I was right, that this woman didn't do a very thorough job. I'm very tempted to do that because it's a small investment. But anywhere you go as a new patient, they're going to want records. I can't call my old dentist in Massachusetts again and say, you know, you want, I need my records sent here. But I wasn't just in for a cleaning. If you can't fit everything in a fucking hour, if it's extra stuff and I'm a new patient, I tell you I'm having problems, then tell me outright. We might not be able to get to the cleaning. They don't communicate with each other. They don't even, I had to repeat everything to the dental hygienist and the regular doctor. They knew nothing. I said everything over the phone, yet I was starting from scratch with them. That's not right either. That's why you send records that they don't even... Or you at least give notes. Even if my records hadn't come, the person I've been dealing with, the doctor and dental hygienist should have had some kind of heads up. Nothing. So have you been having any problems? What brings you in here? I mean, why did I even say anything over the goddamn phone if I have to start from scratch and waste time, and then I have to hear you say 10 minutes later we're not going to be able to do your cleaning? There's no time. And when I get upset, it was, well, most people come here, they do their paperwork online. But that's not my fault. I was here early. Your receptionist could have brought me out the paperwork. She doesn't want me in her precious waiting room. Then let me do the paperwork outside. At least bring it to me. So I have the full amount of time that we'd normally have anyway if I wasn't a new patient. Pissed. I was already pissed. And then she's, we went up doing the cleaning, and she wants to be friendly, and now she's all laid back and whatever. Now we're not rushed. Now we have plenty of time to her to blah, 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 and ask me questions and whatever. But I didn't feel like she was doing a thorough job, because my common sense tells me that I couldn't possibly, if you're telling me my gums are like some 5s and whatever, then there's got to be some deep pockets where my old hygienist would have been using the manual scraper. Stuff you might miss with the stupid electric thing. Only way I could prove it is if I got my ass quickly to another dentist. Because if I just saw somebody and they didn't say to me, oh, your mouth looks fantastic, it looks like nothing, blah, blah, whatever, then I would, and they said the opposite, it couldn't happen in that short amount of time, which would tell me that the other one didn't do the greatest job. I don't base it on, I don't want you to cause me a ton of pain, but I base it on, if I feel a little discomfort, it means you're doing something. And if I don't know. I have no way to know if you did a thorough job or not. I have to trust you did. Because I don't get to spit up in the sink and see the blood. And I said, was there a lot of blood? There was some, but I guess sinks are obsolete. They don't make those sinks anymore. They spit up because I didn't know what was going on. Why am I not spitting up in the sink? The fact is, it's common sense. New patient, you allow for extra time. You don't allow the same fucking amount of time as you would for a regular cleaning when they're doing extra stuff and new patient, and it's not just a perfunctory exam with the doctor like I used to have. It's, I'm a new patient. You don't know anything about me. And I'm trying to tell her about this little nick over here. I just don't like her. I don't like the place. Too rushed. Pandemic's not my fault. There are people that have to use the bathroom. I had to use the bathroom after I didn't get done with the paperwork until almost quarter after. Not my fault. I was there early. It's not like I get any place at the last minute and expect to use the bathroom. I'm always there early. But the bathroom wasn't the problem. The problem was the paperwork that I didn't get until a few minutes after my scheduled time. And then after that, I say, well, I expect people to be in my chair right on the dot, like right at 1, but that wasn't my fault. Well, people usually do the paperwork, but the receptionist assured me without me even saying anything, don't worry about getting the paperwork done. We'll print it out and do it the old-fashioned way. Yeah, and that took away from my time, and then you not have time to do my fucking cleaning.